Let's see. So I'll introduce myself first. Good morning, everybody. It is May 27th, about 11 o'clock in the morning, where I am on the East Coast of the USA. My name is Mikayla Dalton. I am a fertility awareness-based method instructor. I've been certified in the Boston Crosscheck method. I'm very familiar with Premom's products and app. And I have a particular heart for helping people in the difficult times of their fertility charting. Today's topic can be one of those difficult times. It is, we're talking about perimenopause. Some people call it premenopause, and there can be a little bit of confusion about this as a term. Very basically speaking, they're talking about the couple of years or longer of transition time between your regular cycles and embarking upon the menopause phase of your life. So menopause is when you have stopped ovulating and menstruating. And usually we call it when you haven't ovulated or menstruated for 1 year. So it's kind of diagnosed in retrospect, if that makes sense. If you've gone a year without ovulating or menstruating and it's not caused by another health condition, then we would say that you are in menopause. So perimenopause or premenopause is the transitional time of leading up to that. I know a lot of people are wondering if they're heading into menopause, and when it is, we get a lot of scare stories about fertility decline in your mid 30s onwards. So a lot of people don't realize that the median age for menopause is actually between age 50 and 52. So up until that point, women have still been ovulating. However, it is true there is a fertility decline, but we'll talk more about what that means shortly. If you do want to ask questions, I will try to answer them if I can live. If not, there is a help section in the app. And you can also, if you ever want to reach out to me for a consultation, you can find me in the app. You'll get a little peek at my own app here. Let's see. All right. Oh dear, that's way, way too bright. Let me turn this down. Let's see if that shows up. Oh, the background doesn't like it. Here we go. So in the app, this is probably the best that I can manage. You go down to the More section, just down here. So on the right-hand bottom of your screen, you tap More, and then there's Schedule a Consultation here. And then if you select Fertility Awareness Method Instructors, you can find me in there if you ever do need to. So if I can't get to your question today, or you have more in-depth questions, or you need to reach out to somebody, there are options in the Premom app for you. Okay. So let us begin to talk about premenopause. I have a bunch of information for you. Here we go. All right, so what is it? A time of transition from regular ovulatory cycles to menopause. The time that it starts can vary because the time that you go into menopause varies. A general sort of age to start watching out for signs is about the age of 43. I will share with you that I am currently 44 years old, and I have seen a change in my cycles. During this time, this transitional time of perimenopause, your fertility patterns can vary greatly due to fluctuating hormone levels, fewer follicles, less responsive follicles, defective, that's a horrible word, or immature follicles, or less responsive reproductive tissues in general. Generally, the time of perimenopause is considered to last between 2 to 5 years, okay? Okay, so during the changes of perimenopause in the hormones, what you see is initially an estrogen level rise. So estrogen levels might look normal, or they may rise. The ovaries respond less to stimulation and they produce fewer follicles. And then you will see an estrogen level decrease. And your pituitary gland increases the production of the follicle stimulating hormone to try to stimulate the ovaries. So your ovaries are responding less to stimulation and producing fewer follicles, which have the immature eggs inside them. And so your brain basically is telling your body to ramp up the production of follicle stimulating hormones to try to stimulate the ovaries and compensate for that less responsiveness, that lowered responsiveness. Your attempts at ovulation will become less successful. You may have weak ovulation, or you may try to ovulate, but your body doesn't actually release the egg. And so there's an attempt that fails. Your pituitary hormone LH, the luteinizing hormone, gradually increases over the perimenopausal transition. Eventually, the ovaries are no longer able to respond even to the increased stimulation of high FSH levels. Without ovulation, your body no longer is producing much progesterone. Ovulation ceases, and then menstruation ceases, and you are in menopause at that point. So what might you see on your chart that could point to signs of menopause? So general cycle patterns. You can see delayed ovulation. You can see long cycles. You can also see early ovulation and short cycles and a short post-ovulatory phase. So after you peak or after you ovulate, you might have fewer days between that and your next period. Okay. So those are the general cycle patterns you might want to look out for. There are also other changes that you can monitor. So if you're looking at your cervical fluid, also known as cervical mucus, it is a biogel, very important and a great indicator of your reproductive health. So fluid changes that you might see limited or absent fluid. You might see limited or absent fluid with very fertile characteristics. So you might see fluid but you might not see as much of the most fertile type fluid that you would see. That's the stuff that's clear, slippery, and very stretchy. Some people call it egg white, or very watery kind of fluid that can come with a very wet sensation. So you may have very little fluid at all, or you might have fluid, but it's more creamy, pasty, and you never really see much of that super, very fertile fluid anymore. You might have an extended number of days with fluid that's of the less fertile type. You might have patches of fluid days that come and go. So those are some kind of cervical fluid changes to look out for. Bleeding patterns. You might have a really heavy period with or without clots, and that might be new for you. You might have a lighter than usual period. You might have bleeding that goes on for a prolonged amount of time. You might see spotting before and after your actual menstrual period. So you might have a couple of days of spotting leading up to it and a few days of spotting immediately following. And you might also have bleeding and spotting that is not menstrual. So you might have mid-cycle bleeding and spotting, which is a hormonal bleed, and a hormone breakthrough or hormone withdrawal bleed. So your bleeding patterns can change. And your temperature patterns, if you are tracking your basal body temperature, you might see a delayed temperature rise after peak or after ovulation. You might see a shallow temperature rise. So you get a rise, but it's not as significant as it's been in the past. You might see shallow high temps throughout the post-ovulatory phase. So that's your luteal phase, the time between ovulation and your next period. And you might have temps that are high, but only just, and they don't increase as much as you would have expected or you were used to. Or you might have an absence of a temperature rise, which can indicate that perhaps you didn't ovulate at all. Okay, so let me just make sure that you are aware that all of the things that I've just mentioned can be caused by other changes in your body or other conditions. So you should always rule out other causes for these changes. Just because you see a different cycle pattern and different bleeding patterns, it doesn't necessarily mean that you are in perimenopause and you're heading into menopause. It could be something else. So always do see your trusted healthcare provider for a personalized evaluation. It would be great if they can use your chart as a diagnostic help to help them decide on the right tests and any possible treatments. That's always nice for your medical provider to have that knowledge of fertility charting as a tool. But so just wanted to make sure that you realize that these things don't necessarily mean that you are in perimenopause, but they are common signs of going into perimenopause. Okay. Other physiological signs, there's ones we've all heard of. We've all heard of the hot flashes and the night sweats and things like that. So yeah, hot flashes, night sweats, vaginal dryness, that's an unpleasant one, mood swings, weight gain. Estrogen actually uses a lot of energy to be produced. And when your estrogen levels start to lower, that energy can go into, that energy stays in fat storage. So you may have weight gain, you may get sleep problems, you may develop anxiety or depression, or problems with memory and concentration. Again, you should always rule out other causes for these changes, okay? Don't just jump into assuming that it's perimenopause, because these things can be caused by other conditions as well. Okay, so for us here at the Get Pregnant group with Premom, we are trying for pregnancy. So what is fertility during perimenopause? Okay, so from the age of 41 through 45, approximately 90% of your cycles are ovulatory cycles. Okay, so that's good news. From the age of 46 to 50, 85% of your cycles are ovulatory cycles. So that's probably surprising to you because we hear that fertility drops off a cliff. So you are still ovulating in most of your cycles between bleed to bleed, okay? Most of the time, between 85 and 90% of the time, most of the time you are ovulating in between bleeds. The difficulty with conception can be that you might have long cycles, so you're not ovulating very often. If you're having cycles that are 50 days long, there are fewer opportunities throughout that year to conceive. Another is a decline in relative fertility. So here are some more statistics for you. From the ages of 40 to 44, you have a 64% decline in relative fertility. And from the age of 45 through 49, you have a 95% decline in relative fertility. Okay, remember these are relative. So if you are age 45 and you just heard me say you have a 95% decline in relative fertility, it doesn't mean that you only have a 5% chance of conceiving. It means that your relative fertility has declined by 95%. So you are personally less fertile than you used to be, but it doesn't mean that you cannot get pregnant, and it doesn't give you an exact figure for determining your likelihood of conceiving. So your cycles can change if you're getting a short period of time between ovulation and your next period. It may be difficult to conceive or to sustain a healthy pregnancy. So be aware of what your cycle pattern and balance looks like. Those figures are worth just having in the back of your head. Okay, so there are different stages to perimenopause. We have the late reproductive stage, the early perimenopausal stage, the late perimenopausal stage, and then menopause. All right, so cycle length variation is probably the most accurate marker to identify the start and staging of reproductive aging. In the late reproductive years, shorter cycles are typical and may be interspersed with a more typical cycle length for you. And the length of this stage is variable. I can share with you my own experience. So I am 44 years old right now, and my cycles were always on the longer side. They were healthy, but I had cycles that were on the longer side. So more like the 36-day cycle or 35 to 40-day cycle throughout my 20s and 30s. So when I was ovulating most likely in sort of the mid to late cycle day 20s. Okay. After my third child was born in sort of, let me think. I don't want to Oh, my cycles changed after my third baby. So I had the transitional postpartum breastfeeding kind of experience of cycles. And then when they settled back in, I had a new normal. And my new normal, instead of having a 36-day cycle, and I would tend to be peaking and ovulating around about cycle day 19 to 22-ish, 23. And I would have um, cycles in the low 30s in overall length. And then as the years went by, I saw that ovulation was creeping forward. It slowly and steadily crept forward so that now, instead of peaking on cycle day 19, or between cycle day 17 and 21, I am now peaking usually between cycle day 11 and 15. So to give you an idea, that's how my cycles have changed as I've aged. They've gotten overall shorter, and peak is coming earlier for me. Um, I'm expecting any day now, basically, to have a random early ovulation, like a very early, like a peak on day 9 or something like that. So that is the late reproductive stage. I can still conceive. I can see that I am ovulating regularly still, and I can see that my luteal phase, the time between ovulation and my next period, is a decent length. My temps are looking great. My LH tests are looking great. I'm still pretty fertile at the age of 44. I know I have declined relative fertility. So in the past, I might have been able to conceive from having sex, 5 days before ovulation. It might not be that easy for me now. I might need to time it closer, much closer to ovulation to successfully conceive. So your early perimenopausal stage, you will see increased variability in your cycle length. You'll probably see short cycles interspersed with normal length cycles for you, and also longer length cycles. You might see a difference of 7 or more days between the length of consecutive cycles. And if you see that difference of 7 or more days between the lengths of consecutive cycles, and that occurs at least twice in the last 10 cycles, you can pretty much say that you are probably in the early perimenopausal stage. At this stage, you probably have normal or elevated follicle stimulating hormone, FSH. You might have other symptoms like hot flashes. Length of this is variable. Say 2 or more years, or about 1 or more years. And then in late perimenopause, you'll have even more variability in your cycle length. So a very short cycle, as short as 17 days even, but doesn't have to be quite that short. Very short cycle followed by a very long cycle. And long cycles become more typical. You'll have at least one cycle of more than 60 days in length overall. You'll have random elevated FSH at greater than 25, 25 MIU per mil, IU per liter. And you are likely to have other menopausal symptoms like hot flashes. And this stage, the late perimenopausal stage, lasts from 1 to 3 years. Okay. And then menopause, as I've mentioned, is the total cessation of menstruation. You have 12 months of charting without any bleeding. You'll have random elevated FSH of above 50 or consistently above 30. The median age for this to occur is between the age of 50 and 52 in the USA at least, and across other, I think it's similar in the UK, similar in Australia. I haven't looked at other countries around the world, so I can't do that comparison for you, but I'm happy to look it up if you want. So initially after menopause, FSH and LH stay high, estrogen is low, and virtually no progesterone is produced. And eventually your estrogen and FSH levels stabilize. So that's the sequence of how it can go. There is one little cool thing I wanted to share with you, if I can find it. Yeah. If your cycles vary in length by 44 days, you're about 2 years before menopause. So that I like that because it gives me a timeline. So I'm going to keep a watch out for that. And if I see my cycle lengths overall are varying by 44 days, I'll be like, oh, it's going to be all over and by 2 years. And I will know. Again, if you have any questions about your own personal health, if you are seeing changes in your bleeding or in your cycles, again, a lot of the things that I spoke about can be perimenopause, but may also be something else. So make sure that you have somebody dedicated to you and your health to check it out. If you need to speak to a consultant through Premom, you can do that through the app. You go to the More section on the lower right-hand side of your app screen and then select Request a Consultation. And there are varying types of people you can consult with. If you wanted charting help while trying to conceive and you think you might be entering into that perimenopause time of life, I'm happy to help you with your charting. You can find me under the Fertility Awareness Method instructor area. It has been an absolute pleasure to talk about this with you. There are a lot of us of the age where this is becoming very timely to discuss. And I'm happy that you're on the journey with us. Thank you and goodbye.